Hey guys, Dr. Rodman here. I'm going to talk about 3 reasons why I think people get hurt on rowers. Now, I'm not here to coach or teach any specific rowing techniques. That's different depending on where you're going. But the 3 reasons I think are people that have decreased ability in their ankle to kind of get to this range of motion without really lifting up their knees, staying flat. So decreased ankle mobility. Also, what we have is decreased hip flexion. So you see when people can't really get good hip flexion, they start to round their backs a lot really forward and increase a lot of stress on their lower back. So hip flexion, and then also when people start flexed and end extended, and they keep doing this flexion to extension, what that does is it creates a real shearing stress on the discs. So we're going to talk now, if you want to watch just that, those are the 3 reasons, but if you want to keep watching, you go to our YouTube channel. What we're going to do is explain the ways to correct those. So thanks for staying with us here. What we talked about was decreased ankle mobility, decreased hip flexion, and also we talked about people that when they row, they round, kind of get that loose core, and then they hyperextend. Especially while you're sitting, there's a lot of compression on your disc. So to kind of round and hyperextend can create a lot of shearing on the stress on there. So what you can do is if you're going to start, whatever position you start in, you want to end in that position too. So if I start flexed, I want to end flexed or maybe a little bit neutral, but not hyperextended several times. So stay flexed and flexed. Or if you're going to start neutral, stay neutral and neutral, but you just want to avoid this type of motion. So that's number 1 reason why I think people get hurt on the rower, is that. But number 2 is a decreased ankle mobility. So what you can do at home for that is number 1, work on the soft tissue in the ankle with the foam roller. And I always like to work on the muscle first and then get into the joint mobility. So basically, a lot of times the ankle won't move very well because of the calf. So what we're doing is basically using that foam roller to scan for lumpy, bumpy sore spots, holding pressure on there, and just leaving that pressure on there for about 20 seconds. And then you're gonna go ahead and do side to side for 20 seconds, and then try to stretch the muscle for 20 seconds for a total of 2 minutes. So that's how we kind of clear out some of the muscle issues. Now next you want to move on to, sometimes the ankle won't move because it doesn't have an ability to dorsiflex. It actually can be a joint issue. This actually was huge for me. I had some ankle issues for a while, worked on the muscle all day, but nothing happened until I kind of did this movement here. If you come around here, you can see it got a lot better. So you can use a box at the gym, something soft so you don't hurt your ankle. And basically what you're going to do, you're going to get into this position. You're really just going to push down on the back of that calcaneus, the back of that heel, for about 5 seconds and release. You're going to do that about 30 times. 5-second hold and release. And while you're doing that, you can actually kind of point your foot up too. And that's going to help increase the dorsiflexion of your ankle, which is really important for people in squats who kind of fall forward a lot. If they don't have that dorsiflexion, the ability of their ankle to bend, a lot of times they round forward too. So that's an important thing for many different issues. And the last thing we were talking about was hip flexion, being able to bring that knee to your chest. So if you're rowing and you can't do that, you're going to start to round. Also, this is good for people who are deadlifting, who when you see them set up, they really can't get into that deep squat. They kind of round here. A lot of times it's because that's the same position. They can't quite get their knee up to their chest. You should be able to get 135 degrees of hip flexion without extending or swaying back side to side. So do that check at home. See if you can get 135 degrees. And if you don't, this next mobility technique is helpful for you. So I get the strong resistance band, and I want to put my leg in there, either leg to start, and you're going to get that band pulling out laterally. What you're going to do is just kind of get into that hip flex position. You're going to kind of force that range of motion while that band is doing a lot of stretching. So what I'm focusing on here is really trying to get my chest to my knee and just really kind of settling into that deep hip flexion. So this is really good if you're having a lot of rounding of your back issues on deadlifts too. So basically you're going to hang out here with your chest over your knee for about a minute. For the next minute you want to get to this position where your chest is kind of towards the floor. And you're just focusing on doing some nice, slow, deep breaths. And for the last minute, you're going to try to do the opposite side. So you're going to actually get your chest over your knee, over here, and really try to sink into that. It should feel a little bit of a discomfort at first, but if there's a real deep pain, you may want to get that checked out. But it's going to feel, especially if you're tight and you're forcing that range of motion, it's normal to feel kind of a pinching or just a tightness in there. But after about 3 minutes, you should feel a good difference. And then go ahead and test and retest again, and you should get a better hip flexion. So those are my 3 reasons why I think people get hurt on the rowers. Hopefully that'll help you. If you think this was helpful, please share it with your friends.